Let's look back for a minute at where we've been so far in the seminar. You can use this as a reality check to see if you're getting the information from class and the readings that I'm intending you to get. In the first class, we looked at defining ethics as the study of determining the right thing to do. Right is determined by the era in which the event took place, as well as the culture. You were asked to read Chapter 14 to develop some insights into cultural differences and determinants in appreciating what is ethical. It was brought out that you have choices in your actions, and consequently, what you choose to do is a reflection of who you are, or the person you are, and what to believe. In the second class, I wanted you to see the difference between personal ethics and professional ethics. This leads us to see why professional ethics is important. The founders of ASHA wanted to ensure the profession was respected by the public, so they established guidelines for SLPs and audiologists to direct their professional behaviors and set a universal standard for all workers in the profession. As established, the Standard Code of Ethics is important because not everyone would necessarily think the same way about situations. Therefore, the Code of Ethics helps to establish unified behaviors or a sense of what's right among all those who work in the profession. I wanted you to read Chapter 1 to see how values develop as we mature and to understand that there are differences in perspectives by reading about value cohorts. As you likely have figured out, belonging to a value cohort does not guarantee that everyone believes the same thing, but I believe that it's beneficial to understand and respect group differences. In the article by Roy Shin, he discussed SLP as a monopoly, sanctioned by the general public to practice the profession of speech pathology. This authorization comes in the form of being granted a license by the state, nationally certified by ASHA, and to teach in the schools, we need a teaching certificate, which is granted by the State Department of Education. These credentials require individuals to meet certain minimal educational and experiential requirements to become licensed and certified. Without these credentials, it would be unethical and illegal to do speech therapy. With this privilege comes responsibility. Our professional code of ethics is the document that enumerates the standards by which we practice our profession. It is part of our commitment as a speech-language pathologist to uphold our responsibility to the public. I also wanted you to read Chapter 4 to develop the concept of rights, those things a society deems fundamental, or the givens, that reflect the basic fabric of our society in which we live. The rights inherent in a society reflect the values of that society. They represent a minimal goods, services, and freedoms that are offered to each and every member of its citizenry. The Code of Ethics helps guide our decision-making and understand what the right thing to do is as a professional. It puts all SLPs on the same page and provides support when we decline to do things that violate these guidelines. Finally, in Class 3, we looked at some of the basic universal tenets of professional practice in healthcare. This is laying the groundwork for us to look at how our profession has integrated these concepts or interpreted them into the ASHA Code of Ethics. These contexts are amply explained in the textbook and include beneficence and non-maleficence, working to benefit the patient, doing no harm, autonomy, which is the right to self-determination, role fidelity, which is faithfully acting within the scope of our prescribed duties, veracity, our obligation to tell the truth, the whole truth, confidentiality, maintaining privacy, and justice, seeking fairness. Other important concepts include informed consent, ensuring that decisions are made with all the pertinent information at hand so patients and subjects can make an educated decision. Conflict of interest, making decisions which place the client's interest first. And fiduciary responsibility, afforded a privilege, for example, the right to practice speech pathology. The professional holds a special duty to act responsibly in the interest of those we represent. From the readings in the text for today's class, Chapter 3 was intended to support the class discussion of the basic tenets underpinning ethics and, more specifically, ASHA's Code of Ethics for the profession. ASHA's Scope of Practice document is one of the assigned readings for next week. You'll see that the jobs a speech pathologist can and cannot do are outlined in this document. This is a very important document as it is sometimes used to support the SLP's refusal to undertake an activity that may be asked of them. If you are requested to do something not considered within the professional realm of what speech pathologists are expected to do, or is beyond your training, you will be able to use this document to support your refusal. For example, a speech-language pathologist cannot make a medical diagnosis. Even when all of the facts and information point to a particular diagnosis, let's say vocal nodules, the speech pathologist cannot assign a medical diagnosis because that's the role of the physician. In addition to duties within the scope of practice, you need to be competent to perform them. If not, you should refuse to complete that task. In other words, just because a swallow study is within the SLP's scope of practice, you shouldn't do one unless you're capable and competent, have experience, to do it. While that's common sense, your future workplace may pressure you into doing one. That would put you in a very uncomfortable position. But it is clear that it would be unethical to do so, as it would endanger the patient. So here we are. With all this background information, we're ready now to look at what ASHA's done to shape our professional practice. You'll see that there are only 4 ethical principles in ASHA's Code of Ethics, but there are many, 37 if you want to count them, rules which help us to understand and how to interpret the principles and guide your practice and thinking about what's right to do. So I look forward to seeing you in the next class.